This is the Emergency Medical Minute, sponsored by Mile High Ambulance. The Emergency Medical Minute is excited to announce that we are now offering AMA PRA Category 1 credits. This is accessible through our online course modules that can be accessed at www.emergencymedicalminute.org/CME-courses, or simply by clicking on the link in our show notes and creating an account.
Good morning, everybody. This is a little bit on the topic of elderly head trauma on anticoagulation. So we see lots of people that fall and hit their heads, a lot of older people, and a lot of those people are anticoagulated. You know, when younger people have head injuries, we have different decision rules to decide who may or may not need a head CT. But it's pretty straightforward that if somebody's older and falls and hits their head, especially if they're anticoagulated, they're going to get a head CT. The question is what to do if they have an initially negative head CT, because there's a possibility that if you're anticoagulated and you fall and hit your head, you might have a negative head CT initially, but then you get this delayed head bleed that, initially the head CT is totally fine, and then at a point later on, you will have bleeding in your head that doesn't show up on the first head CT. So there's been studies that have looked at this previously, and they're a little mixed. They show that anywhere between like 0.5% to 6% of patients who have a negative head CT initially will get a delayed bleed. And then another part of the problem is that the timing is uncertain. Previous studies have shown that it could be anywhere from a couple hours up to a week out that people will have a head bleed that shows up. It's, uncertain how bad these bleeds are and what to do about it, because we can't just keep all these people in the emergency department for a week waiting for them to, get any problems. So there was the biggest study to date recently looking at this subject, and it basically took all elderly people who fell and had any kind of head injury and are anticoagulated and looked to see what happened when they had a protocol to repeat head CTs on all of them at 6 hours. And first interesting thing was that about 18% of the people had a positive head CT initially. So, it's a group of people that we scan them, and we're going to find a lot of bleeds when they fall and they're on blood thinners. But then when they kept all of them around and did the repeat head CT, less than 1%, about 0.9%, had anything on that repeat head CT, and almost none of them had an intervention. So none of them needed surgery. None of them had anything done. And most of them didn't even have any symptoms with that second head CT when they had a bleed. So, I think what I do and what a lot of people do is just giving good return precautions, telling patients that, you had a negative head CT, but when we discharge them, we should all kind of emphasize to them that you could get bleeding. We don't know when it'll be. It could be in a couple days. It could be out to a week out. So if you get a bad headache, if you feel confused, or if your family member has that, bring them back. Just because that initial head CT was negative doesn't mean there's nothing wrong. But know that most of these people, even if they have a small little bleed, probably will do fine on the second one if they have a initial head CT that's negative. In some of these studies, the people who had Coumadin and had a Supratherapeutic INR were potentially more likely to have delayed bleeding. So, if we see someone whose INR is 4 and we're sending them home, just maybe those people we should really emphasize to be careful. Any questions, comments? All right, thanks, everybody.
We'd like to thank our sponsor, Health One Continental Division, and Swedish Medical Center for their financial contributions to the EMM. Donations from them and listeners like you make it possible for us to fulfill our mission of producing and spreading free medical education to the masses. If you enjoy our show, please consider making a one-time or recurring donation to help cover our operational costs and keep the EMM awesome. Click on the link in our show notes to make a donation. Thank you for listening.